Hi friends, welcome. Today NABH 6th edition chapter AAC and objective element will be 1C. So today we'll see AAC 1C, which is stating that scope of clinical services of each department is defined. So patient should know what and services are available in the hospital. So each of the department scope of services to be defined and to be displayed. So staff should clearly understand whatever the service boundaries hospital is having, whatever the service availability, whatever the service non-availability. So, whatever the scope of the clinical services of each department wise should be defined. Either it can be the emergency services, it may be the OPD services. In OPD services, it may be the cardiology, neuro, ENT, pediatric, general medicine, ortho. So that all the criteria and the scope of department should be defined and it should be reliable. There is no mismatch between the claimed service and the actual capability. Whatever the service we are providing, that should be displayed properly. If we are not providing, then it should not be displayed. If the hospital is not providing the oncology care or the medical oncology, then they should not display like services provided may oncology or scope of services may oncology. If you are providing the medical oncology, radiation oncology and the surgical oncology, then you keep in your scope of services. Or else if you are providing only the medical and the surgical oncology, then you write only the medical and surgical oncology, and you write in the scope excluded mein radiation oncology is excluded in the scope. So it should be prominently displayed, and all the patient and the public should know about it. What and all document is required? Department-wise scope of services must be approved by the management or the medical administration. So all the department-wise scope should be approved, and that department-wise scope you can display in front of the department. Otherwise, you can prepare one brochure, or you can publish in the electronically. You can publish in the TV also, or in website. But it should be displayed. Either you do board, in one place you do it off, or else otherwise on the front of the department if you are displaying, you can display the board. The board, if you don't have the space to display, then display in TV, or else you can prepare the brochures and keep in, or else you can prepare the standee also and keep outside the department what and all services that department is providing. Like gynec, what and all gynec services are there? Gynec and obstetric services. So the high risk pregnancy also the services included. In high risk pregnancy, what and all scopes are there? In gynec, hysterectomy is there or not? Like what and all scopes, it should be included prominently. I'll show you some example also. Any outsourced services should be mentioned in the policy. If you are having any outsourced service, then please mention in the policy. And staff training also should be done accordingly. Right, likely if the anesthesiology department you take as example. So in anesthesiology department, what and all your scope? Anesthesia for the routine surgery, anesthesia for emergency surgery, anesthesia for cath lab, for sedation of the endoscopy patient, and your labor cases, your post-op analgesic and pain relief, your pain relief, pain management, and your radiological related procedure sedation, and your vascular access of trauma in emergency patient, and dialysis spot during insertion of dialysis spot. That time also, if wherever the patient is on dialysis, that time also the sedation if required, the anesthesiology department also like scope is covered. So these are the scope. If you will take the dental, then these are the dental scope is covered, dermat like this. So each department scope should be defined, and it should be prominently displayed. Or else if the display you can't do it by board, you can display electronically, you can put a standee, you can give the brochures to the patient, but the information should goes to the public and the patient. Okay, thank you. If any doubt for the display of the scope of services or any scope of services to be defined and all, then please comment, then I'll clarify it as per my knowledge. Thank you. If you like the video, then please subscribe my channel.